about the misinterpretations, the miseducation, the stereotypes, the ignorance, and the shame that form stigma of mental health and mental illness. That it can exist in anyone. And as I have experienced, and many others living with a mental health condition or a mental illness, and that includes the doctors, nurses, the EMTs, ER, and hospital staff that we may have to go to when we are experiencing other health-related issues. Having known my own personal experiences in those situations and having heard of others and their personal experiences in those situations, I kind of wanted to see where in that healthcare world did they experience it the most. So I took a Twitter poll. This is not meant to shame healthcare professionals. We can't bring change unless there is an awareness to start from. As someone living with a mental illness, disorder, or condition, have you ever felt stigmatized or treated differently in a hospital setting by any of these professions in a non-mental health related situation? Out of 123 votes, 21% said they had felt stigmatized by a general physician, 11% by ER doctors, 11% by nurses, and 57% said all of the above. The stories I got to hear through this poll were varied, but very much the same. It all comes down to something important. If we are putting our lives in a healthcare professional's hands, all of a sudden, if we disclose our medication or our diagnosis, we become that label and that perception of that mental health condition or that mental illness. We're no longer being looked at for the symptoms that we have come in with. Some have gotten the symptoms they came in with ignored. Some are now scared to even disclose their medication because they're hoping for an unbiased look at their physical health. Have gotten the looks from doctors, sometimes pushing aside any physical symptoms I am actually feeling and showing. The word bipolar insinuated to the nurse or the doctor that I am imagining it all. A good portion of the time, they ended up being wrong. My diagnosis, the medication I'm on, influenced their thinking, influencing them more than what my body was perhaps telling them. The comments become hard. The delegitimizing of what I am physically feeling because of my diagnosis or of my medication. If we talk back to that, we are hysterical, or it is our mental health condition or our mental illness as well. It doesn't make us feel that confident in being completely honest when we go to a doctor, to the ER. It doesn't make us feel completely safe to disclose our diagnosis or our medication, which ends up working against everyone involved. When we are seeking care for our health, we want to be able to trust the people who have worked so hard to get where they are in their field, studied so hard to be where they are. We want to be able to trust that. But as you can see from the poll, we're not. People living with any kind of mental health condition or mental illness are intelligent people. It doesn't get taken away from us with our diagnosis. Just like ignorance regarding mental health and mental illness is not completely taken away as soon as a person gets their degree. There has to be more. There has to be care for our health in health care. And there needs to be a sensitivity, the ability to look at us like any other single person walking in to the ER, walking into their doctor's office. The stigma in the healthcare world needs to end for our health. Please. Thank you so much for watching this episode of The Check Check. If you haven't subscribed to The Check Check on YouTube, please do so now. There should be a little button with my lovely face on it popping up on either side of me. Please take care of yourself. It always starts with us, so we can take it out to the rest of the world.